When do I see my patient back after their treatment? So our patients have gone through head and neck cancer treatment, chemo, radiation, surgery, or different modalities depending on the patient. Maybe that patient was a radiation or a chemo only. Maybe that patient was a combined surgery and radiation. In those patients who have undergone radiation, we want to see them back at about 4 to 6 weeks following the stop date of their radiation. Most of our patients, they know that stop date. Now, 84% of you who watch this channel do not subscribe. Consider subscribing so we can grow our guest, education content, and material. So, I schedule my patients typically in that 5th or 6th week of their treatment. I will schedule them 4 to 6 weeks following completion of their treatment. So if my patient has stopped treatment on September the 20th, I may schedule that patient October the 20th to allow them additional time, 4 weeks, to heal the side effects of the radiation fields. During that 4 weeks, myself as the speech therapist cannot really alter those acute side effects. The body is settling down and trying to decide, how do I return back to normalcy after the radiation? Some of our patients at the 4-week mark aren't quite ready for returning to swallowing therapy. In those cases, let's say my patient's stop date for radiation is September 20th, that's their last day. I may schedule that patient 6 weeks following their treatment. So they may be scheduled around November the 1st. Those patients who require additional time to allow the side effects resolve, that's okay. Each body will respond to this treatment differently depending on the initial staging of the cancer, depending on the fields of radiation that were impacted, and how they went through treatment. However, around 4 to 6 weeks post-treatment, I am really looking for that patient to start to show signs of improvement, decreased odinophagia, hopefully some motivation, but it might not be there yet. Those patients are also having difficulty with clearing secretions and saliva management. They may walk in with a spit cup in their hand. That's not unusual for my world. And so those patients at around 4 to 6 weeks post-treatment, I may reintroduce 1 or 2 swallow exercises just to get them back into the rhythm of we want to move those muscles. I hope they've continued to eat and drink something through their treatment, even if they have a feeding tube in place and they're doing free water and drinking sips of water. If they have stopped doing everything, I will then reassess what is it that we can start, whether it's ice chips, something to get the muscles moving again, okay? So now I have a new mindset. My patient has been through treatment. Their side effects are beginning to improve. Their mindset and their spirits are not usually in a great place at this point. And I'm going to start to set some kind of light at the end of the tunnel for them. So I stay positive and I begin to set clear expectations and goals for the patients at this time.